Babies are born with heart defects, and the earlier these are detected, the better chance for survival.
Joining us to discuss this, Dr. Tim Thomas, pediatric cardiologist who works with East Texas Medical Center. Nice to have you with us as always. Boy, I count my blessings. I got two daughters with healthy young women now. But I mean, this happens, and how when you talk about heart defects in babies, how common is it, doctor?
About 1 out of 100 children is born with some type of heart defect. Fortunately, only about 1 out of 500 or 600 children needs treatment or surgery for that defect. The majority of them will get better,
grow out of it,
or they're mild enough that they don't really limit the child's life.
That's amazing. Now, how do you discover that a newborn has a heart defect?
Nowadays, we use ultrasound of the heart, just like people use ultrasound to see a baby during pregnancy, and we actually can see in the fetal heart at 18 weeks of gestation. We do evaluations that young, and we go all the way up to, we have 30-year-olds who started out with heart defects many years ago and still see our practice.
Is there there's no danger to the mother or the child while you do all of this stuff?
Right. The ultrasound does not use radiation, so it's just sound wave technology. There's no known significant abnormality. It does sometimes make the child move around a fair amount, that issue is there. But
so tell us a little bit about heart murmurs. Is that one of the more common defects in newborns?
So a murmur is a sound that is irregular inside the heart. Fortunately, there's a large category of what we call innocent murmurs, where although there is a noise there, it doesn't indicate an abnormality of the heart. And then we have pathologic murmurs where a valve doesn't open or close properly, or there might be a small hole in one of the internal walls of the heart.
Now, again, can a child grow out of this? I mean, can that hole shut all on its own?
Yes, it can. Sometimes this is just growth of the heart that needs more time after birth. We sort of have this idea that the heart is formed at birth, when in reality, like the rest of our body, it continues to grow after birth, and sometimes that's the case.
Now, what are some of the practices that you perform here in Tyler?
Right, so we can see about 95% of the things that a child would need to be seen for in Tyler. We come out here once a week and been doing that, our practice, for more than 20 years. I've been doing it for almost 7 years at this point. So fainting, chest pain, racing of the heart. Many of our patients who did have to have an operation in Dallas, we follow them up out here until they may go many years before needing further intervention in Dallas.
You've been doing this for a while, but you're never not amazed, I suppose, at the technological leaps we just keep making here. You think about all the different forms of surgeries and robotics and less invasive things. What's on the horizon?
Right, so the biggest thing with our patients is they have valves that over time can wear out. Prior to about 5 years ago, that required an additional open heart and open chest, of course, surgery to replace the valve. But now technology exists to go through a catheter through the blood vessels in the leg and go up into the heart and deploy a valve while the heart is still beating without opening the chest, and the patient stays in the hospital 1 or 2 days and then they go home.
Incredible.
Yes.
Doctor, how can our viewers get a hold of you if they need to?
Right, so our one number for our office, 972-331-9700. Our website is pediatric heart specialists with an S.com.
All right.
Dr. Tim Thomas, thanks for stopping in.
Thank you.
Thank you. Up next.